published several books on Ayurveda and writes for various journals. He's the associate editor of
progress to a very decent prescription in terms of Shastra. Every patient coming to us is coming with a product. That product is called disease. Roga is the karya. There are multiple karanas for this karya, and patients will be telling their symptoms according to their priority. So, as a teacher who is teaching the students, and as a clinician who is working with the patients, and as a humble student who is still trying to study the Roga Nidan and Kaya Chikitsa, even though I have the post-graduation, I am sharing my experiences. First of all, be a humble listener to the patient. As soon as the patient is showing the report of increased uric acid, you very well know it will be a case of gout arthritis. Wherever there is hyperuricemia, the result will show 7 milligram serum uric acid, 8 milligram serum uric acid, or even 10 plus. You very well know there is no doubt it is gout arthritis. But remember, gout arthritis with 7 to 8 or 8 to 9 milligram of uric acid will be presenting with different clinical manifestations in different patients. So the prescription will change. So listen to the patient very calm and quiet. You know, when somebody is coming with a case of pain in the big toe, there is readiness, there is swelling, there is tenderness, and the laboratory value will tell there is uric acid is elevated. Then naturally we know it is a case of gout arthritis, but identify the causes which is applicable to the patient. Some patients will tell about the intake of Vidahi Ahara. See, Vidahi Ahara means we may be having so many the language equivalents, but according to the science, Vidahi is that type of Ahara which will take more time to get digested due to the Dravya Swabhava, and then that will be leading to Sama Pitta like manifestation. You very well know Pittam Sasmeka Tishnoshnam Leku Visram Saram Dravam. When this normal Pitta is converted into Sama Pitta or Pitta plus Amanubandha, you know, definitely there will be property level change, pharmacology level change, pathological level change in the Pitta context. Then identify the elevated serum uric acid behaves as equivalent to Sama Pitta in a Sandhi, and we very well know anatomically Sandhis are Kapha dominant. Silish Alingane. When two bonds are meeting together, we call it as a Sandhi. And according to Ayurveda, Kapha is the dominant dosha in Sandhi. Ura Kanda Sirakloma Parvanyamasayo Resa, Medo Kranam Tejikwaja Kavasya Sudaram Ura. So Sandhi Parva, Sandhi is the seat of Kapha dosha. So you are getting the deposition of serum uric acid crystals, monosodium urate crystals, which are needle shaped in the synovial joint of big toe, which is a Kapasthana. So the Sthanika dosha is Kapha, the vitiated Aganta dosha is Pitta. Kapha will produce swelling, Pitta will produce a readiness and temperature. So my dear friends, you are getting swelling, readiness, temperature, a Pitta dominant pathology in Kapha side. That is your primary conclusion. And you are getting a support from the laboratory report, increased uric acid, which is a Paitika Bhava, because which is created by increased Pitta dominant etiological factors. So Hedu level, Linga level, you are getting the clue that when there is a gout arthritis, there is Pitta dominant etiopathogenesis. If Hedu and Linga indicates Pitta, no doubt the Aushadha should also go to the Pitta domain. Because according to our science, there are 3 sutras. Hedu, Linga, Aushadha Jnanam, Swastadura Parayanam, Trisutram, Shastudam Punyam, Ubudeyam, Pitamaha. So Hedu, Pitta dominant Ahara Vikara, like Vidahi, red meat, spicy food, coffee, alcohol. That is Hedu level. Linga level, the clinical features, readiness, temperature, tenderness, everything. Pitta Lashana, then naturally the Aushadha should also be Pitta. So we will naturally go for a Pitta Shodhana, because uric acid is elevated to bring down the dosha. Prabude Shodhanam Tati, from 10 milligram it should come to the 6. Then you have to do a Pitta Shodhana. And you very well know when there is Pitta Shodhana. Am I audible? Somebody is messaging that there is no audible.
Yes, sir, you're audible.
Then why these messages? Please control, it will confuse me. I think I am audible.
Okay, sir.
Okay, you try to answer such questions, okay? See, the thing is, when there is a Pitta elevation, naturally you have to do Virechana. Because Virechana will do Pitta Shuddhi and Virechana will do Rekta Shuddhi. So you will take the pen and write Abhibhatti Churna, Trivus Churna, something like that, 20 gram with the honey for a Virechana. Why Abhibhatti Churna you selected? It is Kapha Pitta. You have to do the Ruksha Virechana because Kapha Pitta both are Snigdha. So Ruksha Virechana, Churna Virechana, then Pitta Shamana, Trivus Churnam, Abhibhatti Churnam, both are good. Identify the yoga, fix the dose 20 gram approximately, 20-25 gram. Then you will be getting a Virechana, Pitta Shuddhi, which may lead to the gradual decrease in the concentration of Sama Pitta. And once the Pitta dosha is getting down, naturally you will see there will be systematic reduction of the uric acid as well as reduction in the symptomatology. You can see the raga, that is readiness, is coming down. You can see the shula is coming down. Then you can apply external treatments like the lepana. Because when you see the Vadarekta, Padayor Moolamastaya, Kadajit Hastayoravi, Akhoriva Visham Kruddham Krishnam Dekam Prathavadi, then Padamoola is Bitto, and Vadarekta, Uttana stage, the primary treatment is lepana. Uttanam, Lebana, Abhyanga, Parishega, Avagahane. So every time I am telling a classical reference to support a clinical point, because we should feel that there is less gap or no gap between theory and practice. Okay, so Uttana Vadarekta, the primary treatment is Lepana. So identify Jadamayadi Churna because Pitta Shamanam. Jadamayadi Lepana can be done externally. Never go to the Taila Prayoga like Pinna Taila. No, because there is swelling Kapanibantam. So if you are applying the oil in the very primary stage, the underlying Kappa will increase by the Snigdha Guna. So select Ruksha Lebana because both the Kappa Pittas are Snigdha. Which Lebana Pitta Shamanam. So you can think about Jadamayadi. So after applying the Jadamayadi Lebana and internal Virejana, there will be reduction in the Pitta systematically and locally. I mean systematically and locally. Then you can give internal Kashayas which are having more action in Pitta Shamana, Rekta Shuddhi. Both coming from the Pitta Adiga Vada Rekta context. Then naturally your pen will go for Kogilaksha Kashayam, Manjishtadi Kashayam, Guruchiyadi Kashayam, Sadavari Guruchiyadi Kashayam. I am repeating. Manjishtadi Kashayam, Kogilasha Kashayam, Guruchiyadi Kashayam, or Sadavari Chinna Yupadi Kashayam, etc. with our Pitta dominant features, and then naturally you will be getting relief. Then if there is more Rekta Dushti and local swelling, Rugyaga Toda Dakeshu Jalu Kapur Vinir Hare. Rugyaga Toda Dakeshu Jalu Kapur Vinir Hare. Apply bleach when there is Rug pain, Raga redness, Toda pain, pricking pain, and Daha burning pain. No doubt again Pitta domination. So keep Jaluka. And again you very well know in Vada Rekta, when there is more Pitta Rekta Dushti, Jaluka is ideal. So multiple theoretical support are converting a gross scenario into a minute point. That point is your prescription. So I am repeating, multiple principles from different corners of Ayurvedic science, irrespective of the chapter, will take you a fine point, and that fine point is the center of prescription. I can tell you from that point only the prescription is getting developed and getting formed into a Samprapti Vigatana. My dear friends, I think you are following me. I think you are following me. Following my pace, following my language, and following the velocity of my delivery. I think it is okay. Okay. So this is the systematic understanding of Bahya Chikilsa, Abhyantara Chikilsa, Shamana Chikilsa with a simple example called gout arthritis, which is getting clinical features, which is supported by laboratory investigation, and naturally you can go with all these things. Okay. So now I am telling you where we are missing. We may miss the clinical symptomatology recording. The patient's lab report we will see. We will not be looking forward into the real symptomatology. Whether it is Kapha dominant Pitta or Pitta dominant Kapha, both are different. So that is to be always taken into consideration. So when you are getting a patient, do all possible clinical examination using Ayurvedic and modern eyes. We do have two eyes. Ayurvedic examination and modern investigations and clinical examination should be processed in your brain, and then that brain will convert it into a successful prescription. That is what we are telling Jnana Buddhi Pradipena Yona Vishyati Yogivat Avirasya Andaratmanam Nasarogam Sivisyati. Until and unless you are not entering into the consciousness, internal consciousness of your patient, you are not going to be a successful clinician. Salute to Charan. That is very important. So never listen only a class of a scholar. You read the textbook. My every point is to empower or to encourage you to read the classical textbooks. The gap should be coming down. We can question everything, but we can question something when we understand it. Without understanding, if we are questioning, that will lead to an ajirna into our manovahas rodas. If ajirna is developing in the manovahas rodas, we may get manasika ajirna, then definitely there will be all srodha in our jnana exchange, knowledge delivery program. I'm telling from experience. Okay. So now we will come to the details. Every time when you are getting the patient, identify in which system it is coming. Whether the pathology is in the nervous system. In the nervous system, I will tell you an example. When I was studying my first post-graduation in Kaya Chikitsa, I was very much oriented towards the classical diagnosis of Ayurveda. When I am getting a patient in my OP or IP, I was studying in Government Ayurveda College, Trivandrum, a very big college with a very huge volume of patients. And my ultimate concern when I was practicing my Kaya Chikitsa PG as a student is to identify the Vada Vyadhi, whether it is Avaranaja or Dadusha. Gopakumar, being a student, was so happy when he identifies that the patient sitting in front of him belongs to Avarana pathology or Dadushaya pathology, because these two are the major two domains of Ayurvedic neurology. So Avarana pathology means obstructive pathology, where there can be cerebrovascular accident like thrombus, embolism, ischemia, or any brain tumor which is compressing the surrounding tissue, or any pathology where there is ischemia to vital brain, or any pathology where there is hypoxia, lack of oxygen to the major brain cells. So all these types of pathologies are called Avarana because Avarano Margasya Rodha. Avarano Margasya Rodha. What is Marga? Marga can be any channel. Marga can be any tube. Marga can be an artery. Marga can be a nerve. Marga can be an endocrine pathway. Marga can be a neurotransmitter pathway. In any pathway, if there is a block, inhibition, suppression, obstruction, I would like to call it as Avarana. Reduced nerve conduction across a nerve is Avarana. Reduced circulation through an artery is Avarana. Reduced secretion from an endocrine gland is Avarana. You know, when there is less production of the thyroid hormone, and there is less utilization of the insulin, peripheral resistance to the insulin, all comes under Avarana. Okay, and then you may be getting another possibility in Ayurvedic neurology where there is degeneration. Degeneration means Tharukshayam, the age-related degeneration of the brain, or the degenerative pathologies like the motor neuron disease, Alzheimer's disease, Parkinson's disease, where there is a reduction in the dopamine creating hormones in substantia nigra. So, my dear friends, there can be two broad level pathology or Samprapti in Ayurvedic neurology, one being the obstructive inhibitory Avarana pathology, the other being the degenerative Dhadushaya pathology. So I was happy when I was able to locate which is my case. So my prescription will go like that way. If there is an Avarana pathology, say for example, there is a thrombus, there is a block in a particular vessel supplying the brain, then I will naturally think about Ashtavargam Kashayam at that time. You know what is Ashtavargam Kashayam? Bela Sakadare Shutti Rasna Sudadrumi, Sindhuara Lesunai Ashtavargo Anilaha. You know, Bela Sakadara Eranda Shundi Rasna Suradruma, Sindhuvara Lesuna. All 8 drugs are Ushna Tishna drugs, which are Kapha Vada Shamana. Kapha Vada Shamana means Kapha Shamanam and making Vada normal. When there is a samsarga of Kapha Vada, Kapha will be dominant, then Kapha will obstruct Vada, then Vada cannot move freely. So when I am prescribing Ashtavargam with Lesuna, with Shundi, with Suradaru, then naturally the Kapha component will be removed gradually and then Vada will become normal. So obstructive pathology, I will think about Ashtavargam. On the other side, if I am getting a pathology where there is degeneration due to a neuron pathology, there is muscle wasting. The muscle mass is coming down, the muscle bulk is coming down due to the denervation or a neurological pathology, I will select a Brahmana drug. Example, Maharasnadi Kashayam, Vidaryadi Kashayam, something like that. So Ashtavargam and Vidaryadi were on 2 sides. Ashtavarga I will prescribe in obstructive Avarana pathologies of nervous system, and Vidaryadi I will prescribe in the Dhadushaya degenerative conditions of neurology. This was my understanding, and it was well supported by the principles. So I was used to ask my teachers at the time when I was a PG student, sir, if you are going to write Ashtavargam and Vidaryadi based on Avarana and Dhadushaya, why you are learning all the modern clinical examination of neurology? Because it is not so easy to study all the neurological evaluation. You have to study the examination of sensory system, motor system, the coordination function, the cranial nerves and the reflexes, everything. So it is somewhat complicated for an average student of 5 years. Then they told you how to study, but I was not completely satisfied by the explanation. But later, when I started my second post-graduation in Roga-Nidana, I studied that there are 2 basic lesions in neurology. Basically, upper motor neuron lesion, UMNL, upper motor neuron lesion, and lower motor neuron lesion, LMNL. So upper motor neuron lesions and lower motor lesions will be presented with distinct clinical features which can be easily identified. Example, if the lesion is in the upper motor level, there will be increased reflex. The tone of the muscle will be very high. But if the lesion is in the lower motor neuron, which connects from the spinal cord to the effector muscle, if the lesion is in between this level, there will be less reflex, reduced reflex, and muscles will be undergoing wasting, and the tone will be very low. Okay, so I know it is Avarana, but I know it is an Avarana causing upper motor neuron lesion or lower motor neuron lesion by the clinical symptomatology and the clinical examination. Then if it is an upper motor neuron lesion, naturally I may go for a Nasya Karma, which will be acting on the prana. If I am getting a lower motor neuron lesion with an effector, muscle is getting wasting, muscle is getting bulkless, muscle is getting very weak with the teaching all these things, I will go for a Vasti, which will be empowering the lower motor neuron. So I may go to Pakvashaya, Vada, Anilomana, Vasti Karma. So Nasya Karma, Vasti Karma are the 2 options available in Ayurvedic neurology. You know, Ardide, Navanam. When we discuss about the Ardida, Navanam is the Nasya. And when we discuss the very chronic old Ayurvedic Vada Vyadis, Vasti Karma Paravidya. Vasti is Ardha Chikitsa. So the selection of drugs, selection of Kriyakrama, selection of Rasayana, etc. will vary significantly if we can apply modern clinical examination into Ayurvedic Samprapti. So I took one more PG to understand that clinical examination is also contributing to Ayurvedic understanding, which can totally change your prescription. I think you are getting it. I think you are following me. Let us take another case of Ababahugam. Amsamula Stido Vayu, Sira Sangochitagaha, Bahu Praspanditaram Genayat Ababahugam, that is what is text telling. It may be a case associated with a diabetic patient. There may be difficulty in the movements of shoulder. There may be periarthritis shoulder. There may be painful arc syndrome, PAS, painful arc syndrome. In all these conditions, you have to empower the soft tissues of the shoulder. Soft tissues of the shoulder means the tendons, the ligaments, the muscles, the artery, the nerve, all these are coming under the soft tissue. We can tell it as Ubadadus. I am introducing something new to you. Ubadadu Pradoshaja Vyadi. What is Ubadadu Pradoshaja Vyadi? Here Ubadadu doesn't mean the Stanya Rida according to the concept which we studied. No. Here the Ubadadu means the soft structures like Snayu, Sira, Kandara. Snayu, Sira, Kandara may represent the neurological ligament or muscle tendon pathology. We very well know the rotator cuff muscles, which are very much involved in the periarthritis shoulder. Definitely the tendons will be getting inflamed at the attachment of bone. There may be neurological involvement, etc. Then what we will do? We will think about the Nasya Karma. Apabhakve Hidam Nasyam. Why Nasya Karma, dear ones? Why Nasya Karma? You just got the benefit of Brahmana Nasya. Brahmanam, Badaje, Sule, Shule, Sukya, Varte, Surakshaye, Nasasya Bhage, Vaksange, Kritra Bodhe, Apabahuge, clearly mentioned. Then Ayurveda told Apabhakve Hidam Nasya. Then you go to the benefits of Nasya with a Panchakarma background. What is told in Nasya? Kano Nada Prasannatva Skanda Gri Vatsya Vashtasaha, Dridendriyastu Apalido, Kaveyur Nasya, Shilina. See, Kano Nada Prasannatva Skanda Griva Vashasaha. See the anatomical level? Skanda means shoulder. Griva means your spine, cervical spine. Vashas means the anterior chest. So this area is highly influenced by Nasya Karma. We very well know the movement which is getting difficult in Ababahuga due to the rotator cuff pathology, due to periarthritis pathology, especially in diabetes mellitus, etc., are affecting this Skanda, Griva, Vaksha area, the triad, where the only treatment which can influence is Nasya Karma. So if it is a Vata dominant pathology in a patient with more Vata, Dhanvantaram Thailam, Vata Pitta Ksheedabala Thailam, a Kapanibandha pathology, Karpasastya Thailam, Anu Thailam, etc., can be selected for Nasya Karma. If it is absolute degeneration, Vata Shamana only, Brahmanam Nasyam is indicated. So now you see, Vata Vyadi Ababahuga Nidanam, Vata Vyadi Chigilsa, Ababahuga Chigilsa, Nasya Bhalasruti, all the three we are connecting with Charaka Subhadha Pradoshta Vyadi with the modern components of rotator cuff injury, periarthritis shoulder, painful arm syndrome, and testing the movements of the shoulder joint by clinical examination, we come to a treatment design. See, now the patient came with a product of pain in the shoulder. We searched our brain into different domains of Ayurvedic classical. We went for Ayurvedic interpretation, and then we have done the clinical examination of the shoulder joint movements, etc. The painful arc we will test, how much he can lift, and all these things finally converted into a treatment procedure called Nasya. Then you may add Prasaranyadi, Kashayam, Parinata Chiryadi, Thailam, whatever you can give, Uttara, Grida Prayoga, etc. You can do. But all these things are not coming from irrational thinking. They are coming with logical thinking. I always tell to my students, and I always teach myself. When I am sitting alone, I try to teach me also. It is very important that you have to always understand when there is a pathology occurring in the body, you have to think in all possible directions. Never go with a pre-decided mind. Never think with a pre-decided mind. See all the possibilities, 360 degrees of vision, then you will be getting the best possible available options in. So that is my humble request. Okay, now I will share you another case. I had a patient when I was working in Trivandrum. The patient himself was a radiologist. The patient himself was a radiologist having very sound knowledge in pathology. He came with the ERS paralysis. You know, ERS paralysis, ERB, ERS paralysis is nothing other than the paralysis which is mainly due to the axillary nerve involvement. Axillary nerve involvement. The same treatment of Nasya we have done, but here what we have done, after completing the 7 days of Marsha Nasya with the Dhanvantaram Thailam 41 Avarti, I continued 21 days of Pratimarsha Nasya. You know, the small dosage, 2 Bindu Pramana Nasya. For 21 days with the same Dhanvantaram 41 Avarti was administered, along with the internal Dhanvantaram Thailam Sevya Panam. Internal Dhanvantaram Thailam Sevya Panam, and the patient got very significant improvement. You know how the improvement manifested? I will tell you. The patient was not able to lift even a cup of tea. That is the initial symptom. They cannot lift a cup of tea due to the weakness of the muscles which are innervated by axillary nerve. And after some time with the Pratimarsha Nasya, I have given him an empty glass. An empty glass which contains no water, nothing. He was able to support like this and take. Then gradually he was able to lift the cup against gravity. Against gravity, that is very important. Then I have added half glass Kashayam. Then after 5, 7, 8 days, he was taking Kashayam with his glass. Then this allopathy-oriented radiologist asked me, sir, what is the treatment you are doing with the Nasya? Then I told, my dear, my Nasya is correcting your Skanda, Griva, Vaksha. What is the anatomical understanding? Ubadadu Pradoshaja Vyadi. What is Ubadadu Pradoshaja Vyadi? Snayu, which Snayu? Axillary nerve. Why axillary nerve with Nasya? Skanda is innervated by axillary nerve. Nerve is Snayu. Snayu is Ubadadu Pradoshaja Vyadi. Snayu Sira, Kandareke, Dushta, Krishnandi Manavam, Stamba Sangoja. Stamba Sangoja is the cause and pathology. Then do the Nasya Karma, which will empower the neurological function of the nerve, Snayu, axillary nerve. So you do it. So I believe the sensory and motor function of a nerve is nothing other than Vayu Tandra Yantradara, Pravartaka Cheshta, Ucha Vajanam concepts. Dear ones, there is a chapter called Vata Kalakaliyam in Charaka Samhita Sutrasanam, 12th chapter. We study all these chapters only for the examination. You may be wondering why Gopakumar is again telling the old outdated slogan. It is outdated only in our examination-oriented brain. It is never outdated in the classical practice brain. Tandra Yantradara, Pravartaka Cheshtanam, Ucha Vajanam. Cheshta means motor function. Uchavajana means again you can see the sensory motor functions are controlled. That is why you do Nasya Karma. So I believe Nasya Karma will be a treatment which will empower the neurological transmission, the impulse carrying capacity, and thereby the better effector or the link. So Snayu to Mamsa Dhatu, that is neuromuscular coordination. Snayu to Mamsa Dhatu, neuromuscular coordination. So that is another example. I am telling with only examples which will give you better clarity. So my dear friends, clinical examination using the modern parameters are very much important, provided you can interpret them into Ayurvedic Sampraya. I will tell you, you know, every time you are doing SLR test, straight leg raising test in Gridrasi patient. Any third year BAM student know what is Gridrasi. They know what is sciatica. In sciatica, there may be a disc bulge from L4, L5, L5S1, and the sciatic nerve may get compressed, and there will be radiating pain starting from the buttocks to the posterior side of the back of the limb, which may come to the feet. That is what is called sciatica. And now I will tell you the SLR is straight leg raising, which is told by the modern clinical practitioners. Let us think about Ayurveda. Pashniya Pratyankulina, Yakandara, Majudargita, Saktilsheva Nigurknavi, Dundrasin Tam Projection. With the beautifully told centuries back that Sakti Ulshevam Nigurknavi. Sakti means leg. Ulsheva means rising. Nigurknavi means affected. So straight leg rising is directly told by a single sloga component called Sakti Ulshevam Nigurknavi. So there is no doubt that the first SLR test was told by Vagbada in Vadavyadi, Nidhanasthanam centuries before the so-called modern textbooks. Am I right? But we ignore the sloka. Whereas when there is a pain in the low back region with the radiation, the teachers will teach you it is sciatica, then it may be equal to Grudrasi, ignoring the component Grudrasi. So I am telling, in Ayurvedic Shastra Bhagas also the evidence of clinical examinations are there. Modern oriented clinical tests are embedded in Ayurvedic Samprati. I will tell you another example. Again from neurology, in Bell's palsy, you know, Vakvakini, Sira Samsta, Jikwa Stambhayate Anita, Jikwa Stambasatena, Annapana Vakyeshu Anishada. I am telling you about a disease which is called Jikwa Stambha. I repeat, Jikwa Stambha, which is mentioned in Padavyadi, where what is happening? He is not simply telling that Jikwa is paralyzed. Our Acharyas are so particular when they describe a pathology, they will start from the cause, then they will end in the effects. From the cause to the effect, that is what is called Samprapti. Yatha Dushtena Doshena, Yatha Cha Anvisapada, Nurvurti Ramayasyasya Samprapti. How the disease is originated, how it is progressing, how finally it is manifested, the route, the road, the traveling is called Samprapti. So let us come back to Jikwa Stambha. What is happening? Vakvakini Sira. See the beauty. There is a Sira, there is a structure called a Sira or nerve, whatever may be Sira, which is carrying the Vak property, Vak, speech. So Vakvakini Sira Samstha Jikwa Stambhayade Anila. Anila means Vata. Will do the Stambhana, paralysis of the Jikwa through the Vakvakini Sira. What is the modern understanding? The intrinsic muscles of the tongue which are performing the speech. Genioglossus, styloglossus, palatoglossus, the tongue muscles, all these tongue muscles are paralyzed by Anila, Stambhayade Anila. Then it is called the Jikwa Stambha. Jikwa Stambha Satena. By which, what is the manifestation? Anna Pana Vakyeshu Anishata. Anna Pana Vakya. Anna means solid food eating. Pana means liquid food swallowing. Vakya means difficulty in speech. So dear ones, difficulty in swallowing solid and liquid foods, Annapana. Difficulty to speech, articulation, Vakya. So Annapana Vakyeshu Anishata, difficulty is telling that dysphagia and dysarthria. How? It is not simply telling by a magic of Swada. No, it is telling that particular Sira which is nourishing, supplying, innervating the Jikwa tongue muscles are paralyzed Sambayadi by Vada, Anila, then Jikwa Stambha, patient cannot swallow, patient cannot speech. Jikwa Stambha, Bell's palsy. So I am telling you, Ayurvedic detailed clinical backups are available in the sloga if you study. But unfortunately, we never study Jikwa Stambha. Now after hearing this lesson, I think you will be getting an interest to read the textbooks of Nidhanasthanam. Then what is the benefit? Then you will be thinking about the medicines which will empower that particular Sira and that particular muscles of the tongue. Then you may naturally go with the Nasya Karma, Pratisarana Karma, Kabala Nandusha Chigilsa, and Grudas which will support the brain for speech. Saraswadagrada, Shadbindu, Saraswadagrada, Ashtanga Kalyana Grada, etc. will be selected, and then you will be empowering with the Nasya Karma, and you will be doing with the Sido Biju, Sido Dhara, and you will think about the Methirasayana like Manduka Parni, like Brahmi, like Guduji, like this all Shankapushpi, etc. So the point is empowering the Vakvakini Sira, empowering the tongue muscles, and treating the Bell's palsy with the Rasayanas, Medhirasayana, Nasya Karma, Murtini Kaila, etc. are derived from the knowledge of a particular sloga called Vakvakini Sira Samstha Jikwa Stambhayade Anila, Jikwa Stambhasatena Annapana Vakyeshu Anishada. So I think the Hutchison's clinical medicine, Davidson's clinical medicine, Harrison's clinical medicine might have read Ashtangrayam Vadavyadi Nidhanam. I am not simply pushing. I am telling you with a logical reasoning. My dear friends, Ayurveda is not a magical science, I believe. To me, Ayurveda is a logical science. There is no place for magic. There is only place for logic. So logical thinking is very much essential. You should be able to read in between two lines of a classical slogan. But unfortunately, we don't try to do it. Okay. Now I will continue with again neurology. There is a disease called Siragraha. There is a disease called Siragraha in Vadavyadi, Ashtangradayam, Nidhanasthanam, where what is the finding? Rektamasritya Pavanaha Kuryal Murdadara Sira. Rektamasritya Pavanaha Kuryal Murdadara Sira. Rutshasa Vedana Krishna, so Asadyasyal Siragraha. Most of the people ignore this. These two lines sloga appear just before Pakshakata. Everybody know the sloga Pakshakata, the Kortam Panur Vayu Sira Snaya Visushija, Pakshamanya Veram Kandi Kemi Plagia, everybody know. Just before that particular famous sloga, this not famous sloga is there. That is called Siragraha. You see what is the anatomical advantage of Ayurveda there? Rekta Masritya Pavanaha Kuryal Murdha Dhara Sira. Murdha Dhara Sira. The vessels which are nourishing the Murdha brain are obstructed by Vada Prakopa, when their tissues will become Krishna, black. Tissue will become black when there is an ischemic damage. A tissue which is oxygenated will never become necrosed. A tissue which is not getting the oxygen, hypoxia, then naturally there will be ischemic injury, the cell will die, that is what is called Krishna, blackness. Rucha means the cell which is losing the hydration. Rucha means Shoshana. Yes, Shoshane Shakti is Rucha. So brain is becoming Rucha and Krishna, degenerated and black, dead. Because of the Murda Darasira, cranial blood vessel pathology, when it is called Siragraha, then you are getting Pakshaga. So I believe Siragraha is the first evidence of vascular abnormalities of brain, which may lead to a cerebrovascular accident, including stroke. So Siragraha is the cause and Pakshagata is the product. We have to study the both, that is what I am telling. So Siragraha should be understood. That is why you are doing all the examination of the cranial nerves. You are doing the examination of the cranial nerves to identify which cranial nerve is affected. I will tell you the importance of cranial nerve examination. Most of the students will tell that it is necessary, it is not necessary, because only it is important in your bedside viva in examination. No. You read Ardida. Dear friends, you read Ardida, there is a reference in sloga, Nishtiva Parshado Yayas. When you speak with the facial paralysis, Parshado Yaya, you cannot spit forcefully straight. If you are spitting, due to the weakness of the facial muscles, the spitting will go to one side. That indirectly telling that the facial muscles are weak. Nishtiva Parshado Yaya. Egasya Ashnor Nimilanam. One eyelid is drooped. Egasya Ashnor Nimilanam. One eyelid is drooped. We call it as ptosis. You know the oculomotor nerve paralysis will be presented with the ptosis. Egasya Ashnor Nimilanam. So third nerve, Gandha Jnanam Smrder Mokatrasa Suptasya Jayade. Again in Ardida. Gandha Jnanam means anosmia. They don't know the smell. Olfactory nerve is affected. Srubihani, difficulty to hear. Vestibulocochlear, eighth cranial nerve is affected. So, my dear friends, more than 5 cranial nerves are affected in a pathology of Ardita as per modern neurology. That is clearly mentioned in our old Samhitas. See how many patients they have seen. They have seen so many number of patients, then they made a syndrome where there is ptosis, where there is weakness of the facial muscle, where there is Srubihani, and where there is Gandhajnana. So, Ardita is not a 12-line Sanskrit poem. Ardita is a classical examination-oriented outcome by hundreds of patient research in the very old season where there is no textbook, no digitalization. They have that much of pratyasha skill. So never consider Ayurvedic pramanas or symbol literature. People complain that why we study all this literature. No, this literature, I remember Sirasa, Bharavarana, Adhikasi Prabhashanat, why? Because it is written in a particular way. So first, my humble request is you do the Amapadana in a disease called Sloga Dvesha. You know, sloga means the classical references coded in a particular wavelength and frequency, which will easily help you to memorize it. But you people consider that slogas create all confusion. So sloga dvesha, kandho baroda, no sloga pravarti. When there is no sloga coming from your mouth, it is not coming from your heart also. My dear, if I am talking to you, you may be listening and I may be speaking, but to me, I am talking to my inner consciousness. The same time I am talking to you, I am talking to me also, so I am justifying what I am telling. So every time you read a classical reference with a logical understanding of the modern pathology, you are convincing your internal brain that you are understanding. That is, you are empowering your self-knowledge. So my dear friends, try to have a more contact with your classical text. Okay, let us come back to some other systems. Okay, we are discussing more with the neurology only. Because it's an introductory class, so I will touch all the systems. Okay, and when we discuss a hypothyroidism, when we discuss a hypothyroidism, we very well know there is less production of the T3, T4. Thyroid hormones T3, T4 are less produced due to the problems either at pituitary level or hypothalamus level or even thyroid level. Hypothalamus, pituitary, thyroid level, triple levels are there, but the end product is less secretion of T3, T4. And T3, T4 directly do the basic metabolic rate regulation, BMR. And BMR related activities are nothing other than functions of Datogini. To me, BMR is done by T3, T4, which reflects the total physiological domain of Dhatu Agni. So when there is suppression to the Datogini, you are getting hypothyroidism, you will be getting weight gain, fluid collection, all lassitude, gluttony, coma, everything. You will gain weight, you will be having cold intolerance, everything. Why? Because Mandaguna Kapha will always inhibit. Remember, Mandaguna Kapha will always inhibit. In any system, Kapha, if it is dominant, it will inhibit only. Tikshna Guna Pitta will always trigger, always stimulate. So Tikshna will stimulate, accelerate, and Kapha with Manda will suppress, inhibit. So Kapha combined with Vada in the hypothalamic pituitary axis will inhibit the endocrine secretion. So you are getting Dhadugata Mandagini hypothyroidism. Same way the Pitta with the Tishna Guna is triggered, helped, blessed by the Vata in the hypothalamic pituitary tract. There will be more stimulatory action, Tishnagini at Dhadu level, hyperthyroidism, heat intolerance. Cold intolerance due to Kapha Vata, hypothyroidism, heat intolerance, Dahadi with the Pitta Vata, hyperthyroidism. Apravarti in hypothyroidism, Adipravarti in hyperthyroidism. Apravarti means lack of appetite in hypothyroidism. Adipravarti means increased appetite and weight loss in hyperthyroidism. But in both area, Vata is controlled by Yoga Vahi, Paramvayu, Samyoga, Dupayartaka, Dahagat, Tejasa Yuktam, Sitagat, Soma, Samshaya. So my point is very simple. Next time when you get a hypothyroid patient, examine for pre-tibial edema. What is pre-tibial edema? You just examine from below knee joint to the feet, and you know the shin bone, the tibia is the most subcutaneous bone. There is less gap from skin to the tibia, so there will be pre-tibial edema. You can very well see the fluid collection. So pre-tibial edema as a clinical symptom, clinical sign is supporting the fluid retention by kapha, sangha, apravarti, weight gain, and naturally it is a kapha-oriented Dhadugada Agni hypothyroidism. But in hyperthyroidism, you know, there will be all disturbing functions at mind, body, increased heartbeat. Patient will be restless, emotionally upset, hair fall, weight loss, heat intolerance, modal shifting. All problems are due to Pitta Vata. So Vata Kapha, Vata Pitta are the two-level domains with the hypo and hyper. When there is Vata Kapha pathology, you will be trying to limit the Kapha, then you will make Vata normal. You can do Vamana Karma, you can do all the treatments like Punarmavadi Kashayam, Ashtavarga Kashayam, Hamsavatyadi Kashayam, Varanadi Kashayam, Gugula Kashayam, Kapavadasana. When there is Pitta Vata, Guduchiadi Kashayam, Sadavatyadi Kashayam, Sadavari, Chida Bhagam, Bila Guduchiadi Kashayam, all the treatments are Pitta Shayam. So Kaphanibandham, hypothyroidism, Virejana Nasyam, Pittanibandham, hyperthyroidism, Shamanam. Anutaila can be given in Kaphanibandham, hypothyroidism, but Shidavira can be given in hyperthyroidism, Dahanibandham, Pittanibandham. Murtini Taila with the Shidavirya drugs are preferred in hyperthyroidism, Pittanibandham. Comparatively, Ushnavirya drugs are used in hypothyroidism. Shida is preferred in hyperthyroidism, Pittanibandham. Chara is preferred in hypothyroidism, Kaphanibandham. So everywhere this is there. When you come to the Rasayana, because in thyroid pathology, there should be Rasayana. Why? Dhatuginis are involved. Lakhopayogi Sastanam, Rasadinam Rasayana. Rasadinam Rasayana. So you have to empower the Dhatogini. Then naturally, you know, Palladaka, Pippali, Shilajadu, Chitraga, Lesuna, like powerful drugs are needed in hypo. Because Kaphanibandham and Sadavari, Amalagi, Guduji, like Pitta Shamana, Shidavirya drugs are important in hyperthyroidism. In both way, Rasayanas are important. Tikshna Rasayanas in hypo, Saumya Rasayanas in hyper. Now I will tell one more point before I leave this thyroid pathology. You read Jora once again, dear friends. If you are reading the Jora from Ashtanga Hridaya, you can see a reference called Dahadi Joram and Shitadi Joram. You know, Jora is the basic chapter. I'm not going to tell you that Jora and thyroid are one and same. No. I'm telling you, you can learn so many fundamental things to be applied in other areas from Jora. That is why Jora is Logapadi, model disease. Dahadi Joram is clinically very much similar to the pathological features of hyperthyroidism. And Shitadi Joram with cold intolerance is very much pathologically similar to hypothyroidism. Read again, then you will understand the difference. I am requesting you. You know, when Ayurveda wrote the sloga, they never thought that in 2021, January 25, there will be a class of modern and Ayurvedic interpretation under the so-called manner. They never thought. They wrote with their observation. But when we study with both the knowledge, it is our brain to connect left and right and process. I mean, left and right and process. That is what I am telling. Then you will see hyper, hypo can be seen in various occasions in classical textbooks. One of the occasion from my humble knowledge is Dahadijaram, hyper, Sidavijaram, hypo, in Jora. Yogavahi concept, Dahagar Tejasayuktam hyper, Sidagar Soma Samshayadu hypo. So that is what I am telling. So everywhere, not only neurology, endocrinology, you can apply the basic modern finding in a very beautiful way. Okay. Now we will go to some other systemic conditions in other systems also. You know, when we discuss about the urinary system, there is a disease called BPH, benign prostatic hypertrophy. Let us discuss various diseases. Benign prostatic hyperplasia, BPH. Sometimes the BPH may go to a prostatic carcinoma. You know, the PSA, this prostate-specific antigen, etc. But there is a disease called Vadashtila in our classical science. There is a disease called Vadashtila in the classical science. Shagar Margasta Vastesta Vayu Randara Mastradaha, Ashtilaham Kanam Grandi, Karu Yadela Munadam, Vadashtilevi Saatmana Wind Mutra Anila Sankathas. What is Vadashtila? Anatomically, he is telling there is a Grandi growth between Shagar Marga, rectum, and the Mutra Marga, was the bladder, and that will grow and that will lead into Vitsanga, Mutra Sangha, and Atma. We know the ultrasound will tell you there is prostate enlargement, and that will be leading to terminal dribbling of urine and maybe leading to constipation. So it is Vadashtila, a growth very well told Ashtila. So Ayurvedic scholars were knowing the anatomical site and the pathology and the clinical feature of the disease, everything they quoted by 3 lines slogan. Then what you will do? It is Ashtila, Grandhi, growth, Kshara Karma. Internally, Paniya Charam, Kalyana Charam. Why Kalyana Charam? Because you have to bring down the size of the Grandhi. Kapha is there. In all the Grandhi, Kapha will be Anubandha. Let us salute Vagbada again. Kava Pradana Kurvanti, Medu, Mamsastraga, Malaha, Brutto, Nadam Swedu, Yam Swedu, Sagrandhi, Gradanar Sandam. Most of the lesions which are cyst-like, which are small growth like, are called Grandhi, Kapha is Manda, Snigda, Slashna, Stira. You need Lekhana Karma by Chara. And then the best chara for anilomana with apanasthana, Kalyanakacharam. Why? Kalyanakacharam is mentioned in Arsho Chikitsa. Again, you can see Tribadu, Tribadu Sreshta, Dimgarishkara Chitagam, Jarjaram Sneka Mutrakam, Andar Dumam Vivade. So Kalyanakachara mentioned in Arshas Apanasthana can be given in Padashtila also because Kappa domination Grandhi, same Apanasthana. Pipalyadi Thailand for Anuvasana is practiced in Padashtila. Vastyamaya Gradam is given us the very important in BPH. You know, Avaveda Sneham. What is Avaveda Sneham? I'm telling the treatment principle of BPH using the classical Ayurvedic literature. Avaveda Sneha is given when there is a Vada Prakopa in Vasti Marma. Vasti is a ornament Marma. So Marmas of the Vada Vyadi should be treated by very serious medicine. That is why we select Avaveda Sneha, Jirnandiya, Uttamaya Mapaya, Yodana Doyam. Administer maximum dose of Buddha into 2 times, and that is called Avaveda Sneha. The best drug used is Sukumara Brudam or even Vastyamaya Brudam, etc. So Avaveda Sneha, Avagaha Sweda, Kalyanakachara and Pipalyadi Anuvasana Taila, etc. are logically applied in a prostate condition like BPH by exploring Ayurvedic and modern Samkrati. So every word in Ayurveda is important. Vada, Tilevi, Sapana, Vinmutra, Anila Sangakar, Vitsanga, Mutra Sanga, Anila Sanga are the key words for us to think further and make a clinical decision. Clinical decision. That is why we have to search every chapters like that, for which you need the absolute patient examination skill. One more thing I will tell you, in GIT examination, in gastro. Tract examination, you have to do the abdominal examination. When we discuss the abdominal examination, especially for ascites, Jalodaram, ascites, we very well know there is a reference in our science, Neela Raji Tadam, Neela Raji. There are blue colored lines. These are nothing other than the tortuous and the dominant abdominal veins due to increased water load. See, Neela Raji Tadam. Then they told Parivurta Nabhi, the umbilical cord will be pushing out. Parivurta Nabhi. Then Atmanam, abdominal distension. See, how many patients Ayurvedic Acharyas have seen with ascites to tell that averted umbilicus, dominant blue-colored abdominal veins are seen in Jalodaram. Then they told, see, Preda Rupa Purusha, Tatmana Pukshaya, because everywhere it will be emaciated and the abdomen will be very much enlarged, so he will look like a Preda Rupa. So each word mentioned in Ayurvedic classical textbooks in symptomatology are telling vital pathological changes revealed by modern clinical examination. When I was studying BAMS, I was surprised why blue-colored lines are seen in the patient. Then I thought that he is a Preda, ghost, so there will be blue-colored. No, it is the dilatation of the abdominal veins which can be easily seen in Catfoot medusa and distension. And averted umbilicus, why? They very well know that due to the internal fluid, the pressure, the umbilicus will become averted. Parivurtanavi. See? And then you come to Udara Chikitsa. This is from Nidhanasthana. So the patient examination in the bedside with the fluid trill shifting dullness we do, then we know whether the fluid is localized or spreading everywhere in the abdomen. Then you will see the references, the Atmana, Parivurtanavi, Neelaraji. Then you will go to Chikitsa. Because our ultimate business is to treat the patient. You know what is the first opening sutra in Udara Chikitsa? My favorite sutra. I think yours also. Doshadi Matra Upajayad, Srodo Marga Nirodana, Sambhavat Udaram Tasmal, Nityanenam Videchaye. Dosha Adimata Upajaya, with the excessive accumulation of the fluids. Srodo Marga Nirodhanal, defective reabsorption. Sambhavat Udaram manifests. So Nityanenam Videchaye. What is the point? Excessive production, defective reabsorption, then there will be abdominal enlargement, ascites, do Nitya Virechana. So see abdominal examination, status of the umbilicus, shifting dullness, fluid trill, plus abdominal dominant veins, then Jalodhara Lakshana, then Uddara Chikitsa, Nitya Virechana to relieve the pressure. A successful Virejana will create the Vata Anilomana by which the osmotic environment will be corrected. Dear friends, when we use the terminology Anilomana, multiple modern pharmacological actions are coming. See, the normal fluid exchange program is coming under Anilomana. The maintenance of the hydrostatic pressure and osmotic pressure is also influenced by Vata Anilomana. When there is a liver pathology, you know the protein production will be affected. Liver is producing protein. And whenever the problem of albumin globulin ratio, the osmotic pressure will be changed. Because osmotic pressure is largely influenced by the proteins present in the plasma. The concentration of the proteins decides the osmotic pressure. If there is a hepatic failure, the concentration of the protein will be changing. That will influence the osmotic pressure. Then there will be edema. The changes in the osmotic pressure is nothing other than Vata Pradilomata. So change the Pradiloma Vata to Aniloma Vata by Virejana Karma and all other medicines mentioned in Udara Chikitsa is highly applicable to the modern pharmacology. We should have that type of thinking to come to a conclusion. No, science is not for arguing. Science is to converge into a conclusion and apply in a very much necessary patient. We can fight for fights. If you want to do the treatment, you interpret the science for the patient. That is my humble request. You interpret your science, you use your tools for the benefit of the patient. It is not a sabha to fight. If you have to empower the liver, you have to prepare the liver to produce the normal protein, you have to treat the Vata Pradiloma, the osmotic pressure, apply the Ayurvedic concepts into the modern light of knowledge, then naturally your brain will be free, feeling some confidence. Otherwise, Virejana will be kept in the shelf. Vidhanasthana will rest in the shelf. Chikitsasthana will not be taken out. Ascites patients will be coming and going from more clinical practice. I think why I am telling I studied Roga Nidana and Kaya Chikitsa separately for PG. So I try to identify as a humble student. I am telling you as a humble student, I feel the relation which I am openly sharing for you. You can discuss. If it is fine to useful, you can apply it. Otherwise, just forget about it. So understanding osmotic changes and the collection of fluid is very well controlled by Vata Anilomana and Virejana. That is why Virejana is a very good treatment for Vata Anilomana. You know what is Anilomana in a very simple meaning? The controlled, programmed movement of Vata in any srotas can be called Anilomana. I repeat, the controlled, programmed movement of Vata in any anatomical srotas is Anilomata. Prana Vata Anilomata, brain function. Sensory, motor, higher mental function is Prana Vata Anilomana. Apana Vata Anilomana will be defecation, micturition, ejaculation, parturition, and menstruation. Reflexes. Okay. So the thing is to make Vata Anilomana, there should not be any Srodhoruda. That is very much important. That is what we are using in Nitya Virejana, especially in Udara. Okay. Then we can go to some other systems. Say for example, in respiratory system. In respiratory system, we very well know the examination of the chest is very important. The balance of Kapha, Vata in Pranavaha Srotas is very important. And actually every physical examination in modern system, every radiological or laboratory or pulmonary function tests, PFT, are really measuring the Kapha Vata friendship in Urus. I am interpreting all the physical clinical examination, pulmonary function test, radiological investigations, including the X-ray test, everything, are telling how much deeply loving Kapha Vadas in the Urus. You know why? Urasya Sudara, Kapasya Sudaram Uraha. Urakanda Shirap, we are telling the Kapastana, Urakanda Shirap Loma Parman Yamashi Urasa, Medo Kanam Tedipuaja, Kapasya Sudaram Ura. So Kapha is very dominant in its Kshetra Urus. The same Urus is the Pranavahanam Srodasa, Hridayam Moolam, Maha Srodascha. According to Ayurveda, Hridaya is not heart alone. In this context of Pranavaha Srodas, Hridaya is inclusive of heart and lungs. I believe it is cardiopulmonary unit together. So when there is an inspirational or expirational problem, definitely there will be an equilibrium problem with the Kapha Vata in Urus. That is why the pathology of bronchial asthma, Tamaga Shwasa, etc. starts with a samprapi called Kapo Varutagavanaha Pavano Vishadvastitaha. Kapha obstructing the Pranavaha Srodas may be the tracheal tree. You know why Kapha? Kapha is Nikta Sandra Slashna Mrstna Shita Stira. So this Kapha will be converted into Sama Kapha in Tamaga Shwasa and other respiratory problems. What is Sama Kapha? Normal Kapha will bless the heart, lungs, and Urus because Pragrata Kapha is Velam. Pragratastu Velam Saleshna. But somebody is affected with the COVID-19 and they are getting the pneumonia, with the chest consolidation, the Kapha is converted into Sama Kapha. When COVID-19 is progressing to a very serious pneumonia condition, there will be always Sama Kapha. And what is Sama Kapha? Avilas Tandulas Piana Kandadeshi Avadishtade, Samo Valasa Durganta Shudugara Bibantha Krip. How beautifully picturized. Acharya never thought that in 2020 there will be COVID. But he was ready with what is Sama Kapha. Avilas Tandulas Piana Kandadeshi Avadishtade. The very mucus, very thick mucus, like thread-like appearance, sticky to the Kanda Deshi Avadishtade. Samo Valasa Valasa means Kapha. Durganda Shud Udgara Bibantha Krips. So there will be Udgara Vibandha, all the breathing problem. You know, finally the patient will go to the ventilatory support. So that is what is called Udgara Vibandha Krips. So there will be Udgara Vibandha, all the breathing problem. You know, finally the patient will go to the ventilatory support. So that is what is called Sama Kapha. When there is Sama Kapha identified by the inspirational, expirational, asthmatic, and breathing problem, established and proven by the pulmonary function test or our oximeter, pulse oximeter, whatever we do now, Pranavada Pradilomata, reduce the oxygen available for the tissue, then you will understand you have to remove the kapha by Pranavada Anilomana drugs. The Stimula Kadutayam, Nayovayam Kashayam, Elaganadi Kashayam, Vyakriyadi Kashayam, Patyashadangam Kashayam, etc. We prescribe even as preventive and curative in various respiratory related conditions. Simply do this pharmacology only. Elaganadi Kashayam, Nayovayam Kashayam, Stimula Kadutayam Kashayam, Vyakriyadi Kashayam, Patyashadangam Kashayam, Punarnavadi Kashayam. All these things are doing the same pharmacology in Judas. So make the friendship back with the Kapavada in Pranavahasrodhas. That is always evident by modern clinical examination. I was very much surprised to see the Vata Pitta Kapha Kasa Lashana told by Acharya. All the productive kapha features are seen in Vata Kasa. All the non-productive features of kapha are seen in Vata Kasa, dry cough, Shushka Kasa. All the productive kapha clinical features are evident in Kabaja Kasa. Kapha Duruvat Murta Hridaya Stimidam Guru, Kandovaleva Sadanam Venus Chartya Rojata, Stimidam, chest congestion, Kapajakasam. Pain dominant Vatakasam, non-productive cough, congestion dominant Kapajakasam, productive cough. Pitta Jakasa will be with Sasra, with Rekta, hemolysis, inflammatory with the fever. So non-productive allergic cough, Vata domination, inflammatory cough with the hemolysis, Pittakasam, and productive cough with the chest congestion, Kapajakasam, can be easily clinically identified by your auscultation of the chest, percussion of the chest, and even simple direct interaction with the patient with the respiratory problem. So, my dear friends, next time when you read Vata Kasa, Pitta Kasa, Kapha Kasa from any Brihatai, you are updating the clinical examination of the respiratory system with the percussion, auscultation. Paravada Iva Pujan. The industry, the adventitious sounds, the plural rub, the wheezing sound, the ronge, all these things are mentioned in our science also. Nishtiva Parsado Yaya, sorry, Kritra Shainas Susudi, Nishana Sosti Merchari, 45-degree inclined position, the patient is getting benefits. But when he is lying, it will aggravate. Increased pulmonary return from the lower limbs will be more, so it will create further condition of the chest. So the patient will feel restless if they are lying, and they will be feeling comfortable when sitting at an angle of 45 degrees. So every word Nishana Sosti Merchari is mentioned in our science. Once they spit the sputum, they will feel benefits. Nishana Swasthya Mrachari, Nishyudande Kshanam Sukhi. So every word mentioned in the classical Ayurveda is testing the significance of modern clinical examination. So the point is simple. Next time when you get the patient, see the patient in a different way. Patient know the complaints. To listen to the complaints and to see the laboratory investigation report, you don't need a BAMS degree. To process this symptomatology and to interpret the laboratory investigation at the level of Vata Pitta Kapha, you need a clinical brain. That is what we have to achieve. So when listen to complaints of the patient, I am going to the next domain. The practical approach I am shortlisting. Listen the complaints first in their own language, then rewrite those complaints in your language, in your mind. Patient will tell pain, numbness, everything they will tell. They will be telling everything because they are the problem-suffering people. But you re-listen or you rewrite in your Manovahasrodhas using your updated G Dhriti Smriti. I am repeating. You rewrite the clinical features told by the patient in your Manovahasrodhas with updated G Dhriti Smriti. Then you will feel the patient was telling about constipation, low back pain, and on USG he is having stone in the kidney. Patient is telling, sir, I am having low back pain, I am having constipation, and I am having kidney stones or ureteric stones in my USG. These three things patient will tell, but you will rewrite it as Pakwasiye Kruddha Sulanaha Andhra Kudanam Mala Rodha Asma Vartha Arsha Trika Prishta Kadigraha. This is your writing in your mind. You need not write the sloka because patient doesn't know the aids. You write in your Manovahasrodhas. So you will see the patient sitting in front of me with the constipation, lumbago, and a particular case of lithiasis. Urolithiasis is coming under a spectrum called Pakwashaya Vadam. So your treatment will be to create Pakwashaya Vata Anilomana in Purishavahasrodhas, in Mudravahasrodhas, and of course in the Astivahasrodhas of lower lumbosacral spine. Then you will select a medicine which will work for Abana Anilomana in Pakwashaya. Naturally, your prescription will go to Gandharvagastadi, Chirivilwari, Sugumaram, something like that. Then you will naturally treat the Vata Anilomana by Eranda Taila preparation, Sindhuvar Eranda or Nirgundi Eranda, or even Gandharvagastadi Eranda, or even Nimbamradi Eranda, if there is Pitanibanda, if there is more Kapanibanda, like a colorectal mass or something like intestinal obstruction, Tingu Tribuna Taila. So such medicines which will create the 3-in-1. 3-in-1 means Ashmari Sthanam, Visharanda Sthanam, Kadigraha, so Pakwashaya Anilomana will be selected, and that will be used for the Upashaya Anubashaya, and then you will proceed. So point is very simple. You need not straight away start the Ashmari Hara drug. First to do Pakwashaya Vata Anilomana, then only go to the Vyadhi Prataniga Ashmari drug. Some doctors, as soon as they hear about a stone, they will think about Vidadagati Kashayam, Tradapapadi, Shivaguliga, or even Bhagatyadi Kashayam, everything. But such a Vyadhi Prataniga drug should be given only after creating the Sthana Anilomana. So understand the site of lesion is very important in Ayurveda. Site doesn't mean the anatomical site as per modern medicine. In modern medicine, when they tell the site means upper limb, lower limb, shoulder, L4, L5, that may be the site. But according to our science, the site may be the same site, but you need something extra like Pakwashaya, like Amashaya, something like that. I will tell the example with a more clarity. When somebody is coming with the bronchial asthma or asthma, normal treatment is to do the bronchodilation. Because you very well know you have to dilate the bronchus. But according to Ayurveda, Urastaha Kudide Swasam Amashaya Samudbhavam. Urastaha Kudide Swasam Amashaya Samudbhavam. So do Amashaya Shuddhi even though the pathology is in the Uras. So what is the meaning? You can prescribe Nayobayam, Agastirasayanam, Dasamudirasayanam, Vasharishtam, Kanagasavam, Swasakudaram, Swasanantam, anything like that for the pulmonary clearance. But care should be given to the Amashaya first. So start prescribing Vaishwanara Churnam, which contain Haridagi, which will create the Vadanilomana in Amashaya, then only treat the bronchodilating treatment. So Vyadi Pratinika Chikilsa is very important, but we would give respect to the Sthana. So my dear friends, the point number 1 towards the final show, Sthana doesn't mean the anatomical site alone in Ayurveda. Sthana means the dosha sthana. That is why Ayurveda told Ayurvedic people know Uras is the problem in Shwasam, but Amashaya is mentioned as Ulbhava Sthana. Urastaha Kujude Shwasam Amashaya Samudbhavam. So some people will even start prescribing Shadharana Churnam before classical Shwasa Chikitsa. Why? Amashaya Gede Vayo Vamida Pradipojide Sukambuna Shadharanam Vajadimba Prayode. Amashaya Geta Vata, you give Shadharanam. Why Amashaya Geta Vata and Shwasa relevant? Amashaya Geta Vata will lead to Shwasa and Kasa also. Amashaya Tritbama the Shwasa Kasa Vishujiga, Kandobaro the Mudgar and Vyadi Nurdamstanapita. See the beauty? In Vadavyadi, Nidanastanam, when Amashaya Geta Vada Lashanas are mentioned, the Kasa Shwasas are also mentioned. I am repeating for you to understand in a better way. Amashaya, Tritbama the Shwasa Kasa both are mentioned. Vishujiga, Kandobaro the Mudgaram, and I am not continuing, he's telling. Vyadi Nurdamstanapita, above Napi, Urtagata Vyadis are all reduced by Amashaya Geta Vada. In such a condition, even though diseases are different, respect the sthana by prescribing Amashaya Gede Vayo Vamida Pradipojide Sukhambuna Shadharanam Vajarimba Prayojaya. Shadharanam is important. The same Shadharanam is indicated in Amavadam also. Amavade Sughambo Vipaya Shadharanam. Why Shadharanam? I am telling about that Shadharanam told by Susruda in Mahavada Vyadi Chikitsa. Of course, the other Shadharanam is there in Pushpa Chikitsa. But in Susruda Mahavada Vyadi, he is telling a Shadharanam like this. Chitraga Indreva Pada Kaduga Adipisha. Vadavyadi Prasamano Yogo Shadharana Smrada. Chitraga Indreva Pada Kaduga Adivisha Apaya. All Anilumana drugs, Deepana Padana drugs are there in Shadharana, which will never create a congestion, Srodoroda in Amashaya or Uras, both are Kapasthana. Amashaya will bless Kapa, Uras, and Uras will bless Amashaya, both are Kapasthana. So make Amashaya pure to keep Uras pure. So first Vaishwanana Churnam, Shadharana Churnam for Amashaya, then only come to the Yadi Pratinika drugs like Elaganadi, Myopaya, Vishapurakatri, whatever you are going to. So that is the point number 2. You have to always do the Vyadi Pratanika Chikitsa only after correcting this Anagada pathology. How you will see? You will do the clinical examination of the chest by auscultation. You can hear the adventitious respiratory sounds like a wrong is in plural, and then you will examine the abdomen. If the abdomen is also having some problem with your clinical examination and the symptomatology, then naturally you will go for these 2 treatments. That is why Vegadharana and this is always running together. Ado Vada Sterodina, Gulmodavar Teruklama, Vada Mutra Sakar Sanga, Drishti Agnivada, Krudgada. So Adhovada Steroda is leading to Krudgada. Purisha Vegadharana will also leading to Krudgada. Sagrada Pindigodeshta Pradishaya Siroja, Urdhamayu Parivartha Hridayasyo Varodana, Mukena with Provertista Purvoktastamayaspada. So again, you will correct Pakwashaya because Adhovada Sterodam and Purisha Vegadharana both will lead to Pakwashayavada Prabhava. Then you cannot limit only with Amashaya, both Pakwashaya. In Amashayagavada, Vamana, Mamita Pradipojide. In Pakwashayagavada, either Vivejana or Vasti. That is why, my dear friends, when Charaga telling the treatment of Swasa asthma, he is telling a beautiful concept. Edehi Kavasamritha Gadiprana Pragobaja, Tasmal, Tanmarga Shuddhyardam, Urdha Ado Shodanam Hitam. For a pure modern oriented think processor, or a thought processor, a thinking man or a thought processor, there is no meaning of Urdha Anilomana, Ado Anilomana in Pranavaha Srododushti asthma, only you need is the bronchodilator. But Ayurveda consider do Urdha Anilomana by Vamana, Ado Anilomana by Virejana for a pathology affecting the in between Uras. I am repeating that concept. Edehi Kavasamritha Jadi Prana Pragobaja, Asmal, Tanmarga. What is Tanmarga? Prana, Vaha, Srotas. Respiratory tree. Tanmarga Shuddhyardam, Urdha, Ado, Shodanam, Hitam. That is why Vamana Videdana both are indicated in Shwasa, even though pathology is in chest. So do the clinical examination of the abdomen, clinical examination of the chest, identify the respiratory problems, including the respiratory sounds, and you can do the percussion to see the notes of the lungs, whether it is resonant or whether it is having the stone-like appearance. You can see what is inside the lungs, whether it is Sthira Guna Kapha or it is normal Vada-filled lungs. You can see from the percussion. You can listen from the auscultation, then you can add from the symptomatology. That is why Darshana, Sparshana, Prashna. So it is coming. So my point is clear. identify the associated clinical examination, even though you are prescribing the medicine for another system. So Agni Deepana, Vatanilomana drugs are very much inevitable in Pranavaha, Srodogatavyami, bronchial asthma. Okay. Now let us come to the cardiology, cardiovascular system. The commonest issue we are getting in our clinical practice is coronary artery disease, CAD, coronary artery disease, where the coronary artery branches will be partially occluded by the atherosclerosis patients, and there will be always movement of the Viana will be affected, angina pectoris. Angina pectoris will be produced when the movement of the Vada, Viana Vada is obstructed by a pathology like Dhamani Pradidayam, that is nothing other than atherosclerosis. To my best of the knowledge, when an obstruction to the pathway of Vada is occurring, there will be always pain. Shulam tu vigunu anila. Shulam tu vigunu anila. If there is a pain in the chest due to a coronary artery block, and that block is contributed by the Resavaha Dushti, because Resavahanam Sodasam Hridayam Moolam, all the Guru Shidam Adisnigdam Adimatram Samasinadam Resavahini Dushyan Chindyanam Adichindana, high fatty diet with emotional disturbance and the lack of exercise will be leading to the atherosclerosis, LDL. Then there will be the problem of Srodoroda, by which the Vyana Vada is obstructed, then you are getting the Shulam to Vigunu anila and angina pectoris. Then you are giving Rasonadi Kashayam. Why Rasonadi Kashayam? Lesuna is the best medicine for all Avarana except Pitta Recta. Pitta Recta Vidurmukta Samasta Avarana Drave Rasayana Dhanena, Lesino Handi Shidam. So when you prescribe a drug like Lesuna Shidam, or when you prescribe a drug like Resonadi Kashayam, you are trying to remove the block Avarana in the Rasavaha Srodhas, that is anatomically coronary artery, and the necessary pathology is a block which is proven by angiogram. A block in the Rasavaha Srodhas or coronary artery is proven by angiogram, or even by a so-called ECG primary, and then you can go for an echo, and finally there will be an angiogram which will tell you the Srodharoda. Then do the Avarana Sara Chikilsa by a Kridya drug. A Kridya drug. When you read Lesuna property in Sutasthana, the Drivyadi Vijnaniyam, you know the first line is Resuna Prashat Vishnoshna, Sodubhaga Rasasara, Kadu, and Kridya. And that is why, my dear friends, Lesuna is mentioned in, Lesuna Kshira is mentioned in Gulma Chikilsa. Because Gulma Hridrogas run parallel. 5 sthanas of Gulma, you know 5 sthanas of Gulma, 2 Parsha, Hridaya, Nahi, Vasti. 2 Parsha, Hridaya, Nahi, Vasti. So that is why Tesha Gulma Nidanokte Hridroga. So Gulma, Hridroga, anatomically, physiologically, pathologically, same, because there will be obstruction to the Vada. Then Gulma Chikilsa with the Lesuna Kshira Bhaga is indicated in Hridroga, Ayurvedic process. When you go to the modern pharmacology, you know the Lesuna garlic contains so many materials like allicin, which are having proven action on the LDL as well as the vascular endothelium. So the action in the vascular endothelium is nothing other than the Rasavaha Srodhos Shuddhi. One more point I will tell you, some detailed point. Srodhas doesn't mean only a channel of circulation. Srodhas means there will be secretion. Sravana Srodhamsi. So the innermost lining of the blood vessel is called endothelium, which secretes so many chemicals to keep the blood vessel intact. So that secretory functions are done by the innermost lining endothelium. That is Srodhas is called Sravana Srodhamsi. When you prescribe Lesuna as Shidabhaga or Resonadi Kashayam, they are creating the Sravana and Sendana in the Srodhas, so there will be less endothelial dysfunction by LDL, so less problem caused by atherosclerosis, and then there can be minimal occlusion by coronary artery disease. That is the pharmacology. You know the pathology, you know the pharmacology, you know the Ayurvedic understanding, you know the properties of Drivya, then naturally the prescription will spread the light. I always tell a joke to my student, your prescription will be just throwing the light. The first prescription medicine will throw light to the second prescription. Second, it will throw medicine to the first. And finally, the entire prescription will be having self-boosting light, and that light will remove the darkness of Srodha in patient. So light in your mind will be communicated into the prescription using your Di, Dhriti, Spriti. With no Srodha in your Manovaha Srodhas, that is the decision making. And this decision making is always done by combining the physical examination, clinical examination, laboratory examination, Ayurvedic Samrati, modern pharmacology, Ayurvedic Divyadi Vijnaniyam, plus your own Yukti. That Yukti is called logical reasoning. That is why I told you, Ayurveda is a logical science, never a magical science. So I wanted to conclude my speech by telling that you have to always do the proper Rogi Parisha by a different systemic examination. You need not do everything. The patient may come with a specific symptomatology, the affected system should be studied. You have to do the 3 things: inspection, palpation, percussion. Inspection is by your Darshana Parisha. By inspection, you will see the changes in color, the changes of deformity, that any abdominal or any other organ level pathology. You will examine the joints for deformity in locomotor system. You will examine the muscle bulk in neurology, and you will examine the color changes in the eye and the mucous membrane in skin and liver pathology. And you will examine the urine, you will examine the purisha, etc. to see the innermost pathology evident. You can do the examination of the chardi, omitus, examination of all body fluids. CSF is examined. The presence of protein in the CSF is very much contributing. When there is subarachnoid hemorrhage, there can be problems in the CSF. So internal fluid examination is important. Aspiration of the peritoneal fluid and measuring for protein. Synovial fluid is aspirated and examined. So that is important. Even the biopsy, what you are doing is nothing other than Darshana Parisha. Instrument aided Darshana Parisha. Added Darshana Parisha is X-ray, chest X-ray, ECG, MRI, and everything is added Darshana Parisha only. Angiogram, Darshana Parisha only. Then you can go for biopsy, Darshana Parisha only. Then you can do the physical examination by palpation, abdominal palpation. Palpation of the joints are having tenderness, pain on touch, whether the joint is warm or it is cold, and whether there is a crepitus sounds are there in the joint, especially in a degenerated arthritis. Such things are important. Then percussion, you can see the percussion of the lungs, percussion of the heart, abdominal percussion to see the underlying visceral condition. So there are 3 points: inspection, palpation, percussion, and finally auscultation is also important. So that is clinical examination. Then you have to see the Darshana Parisha, whether what is the Nidana relevant, what are the symptomatology relevant, what can be the possible Samrati relevant. Then you can definitely go for the laboratory interpretation. When there is raised ESR, erythrocytic sedimentation rate is increased, C-reactive protein is increased, they will tell you that these two acute phase reactants, APR, acute phase reactants like ESR and CRP, they will tell that there is an inflammatory process called PAGA is occurring in the body. PAGA is nothing other than the pathology where there will be the tissues are getting more digested and Dhatu PAGA will be seen. So raised ESR, raised CRP will tell you there is Dhatu PAGA. Interpretation of the Ayurvedic dosha drushti using modern examination is very important. When you are getting more ESR or raised ESR, it is understood that there is a Dhatu Paga. If there is a Dhatu Paga, Dhatu are overactive, then give a Grida Pana, Tiktaka Grida we are administering. Panja Tiktaka Grida we are administering. All these Tiktaras and dominant Gridas are very good against control of Paga. Controlling Paga is nothing other than controlling internal inflammation dominant by Pitta rectum. Any internal Pitta pathology, you can definitely think about Grida, Tiktaka Grida if there is no Ama. Is clearly mentioned Arsho Asra Pitta Manyamsta Suditran Pitta Jan Gadan. So when ESR is coming down, the Guru Guna is coming down, the heaviness is coming down, it indicates that the Amavastha is also coming. Erythrocytic sedimentation rate. Gaurava, Gurutva will lead to sedimentation. So ESR increased means Gaurava, Amanubandha because Ama is Guru. Anga Marda Arjit Krishna, Alasyam Gauravam Juraha, Abaga Sunada Mangana, another selection of externally Sunada. Laboratory test tube, Westergreen's pipette, ESR increased, understanding is Kapha, dominant, Ama, dominant, Gaurava, to Langana. That is why the basic treatment for Amavada is Langana. Langanam, Sedanam, Tiktam, Divanani, Kadunija, Malana, Padanani, Yathavasta Pramena, like that. Langanam, Divan, everything is indicated in Amapadana because Gaurava will be there, and Gaurava is reflected by increased ESR. So every diagnostic measure, Dhatu Paga, when there is SGPT, SGOT elevation in a hepatic injury, you know the liver enzymes like SGPT, SGOT are elevated. That indicates that there is a tissue level Dhatu Paga at liver. In Neger Vidradi, in cirrhosis like Halimaga condition, you very well know there will be Pitta dominant Dhatu Paga, which is evidenced by elevated SGPT, SGOT, do the Dhatu Paga for Chikisa. Padoladi Kashayam, Pandadikta Kashayam, Buduchari Kashayam, Arujavardini Badi, Virejanavi Kalvati Churna, etc. are controlling the Pitta. Same way in alcoholic steatohepatitis. When I am talking something about the laboratory investigations and their interpretation in Ayurveda, when there is fatty liver, what is the clinical understanding? You are measuring the triglyceride, you are measuring the lipid profile, then you are getting the picture that there is hypercholesterolemia, hyperlipidemia, and the UST is telling that the fatty liver is moderate. The UST is telling that there is fatty liver, then what is your clinical interpretation of this examination? You will identify in Pitta Sthana liver, in Rektabaha Srodomula liver, there is more kapha, there is more medas. How evident the big vacuole seen inside the hepatocytes indicate there is kapha medo dushti with this Snigdha Guna Vigalpa Samprapti in liver. So treat kapha medo shamana in Pitta Sthana, that is the logical understanding. Then what you will do, you will combine Padoladi Kashayam and Varnadi Kashayam together with preferably Tripala Kukulu. My favorite prescription. Padoladi Kashayam with Varnadi Kashayam combined with Tripaladi Kukulu is the best prescription for alcoholic fatty liver because Padoladi will take the medicines of Varnadi to the liver. Padoladi will work as a vehicle because it is a Pitta Sthana having affinity. Padola Kadilohani Chandanam Madhusrava Guluji Padanidam Nikandi Kavavita Vishamam Bami Marojagam Kamala. Then you will combine with the Varanadi. Why Varanadi? Varanadi Kavamedo Bandavinidam Nature, the Antivadam Sirasulam, Bulman Chandasa Vidadi. So the combination of Padoladi plus Varanadi, Stanagada, Yagagata, Kavamedo Hara drug, empowered by Tripala Bukulu. Medo Hara, Leda Shoshana, Restina dominant drug. This is the way how we are generating a prescription. There is no chapter in Ayurvedic textbook called Adhada, alcoholic steatohepatitis, Adhyayam Vyakyasyamaha. I used to tell. Students will ask, but where fatty liver is mentioned? My dear, it is not mentioned anywhere. It is mentioned everywhere. It is not mentioned anywhere. It is mentioned everywhere. When you understand the Kapha, Medas, Snigdha Guna Vigalpa, in Pitta Sthana, Yadurte liver, you study yogas, Padoladi, Varanadi, Tripala Gugulu, everywhere these yogas are there. Just to process using the common sense and logical interpretation, then medicines will come. Actually, I am telling you, Ayurvedic treasure house is very big, like a Reserve Bank of India. Having that much of medicines are there. The only thing is which medicine is to be taken. which you need the proper patient evaluation, proper disease evaluation using Ayurvedic and modern things. Never it is completed. I am telling so many things today, but you can add millions of points because common sense has no boundary. Common sense has no boundary. For improvement, sky is the limit. So that is why study a concept. When you learn a point that Vada is Ruksha, it can be applied to any level based on the imaginatory and logical calculation of your brain. Ruksha Guna in the skin is dryness. Ruksha Guna in the eye is Rocalvia. Ruksha Guna in the eye is dry eye syndrome. Ruksha Guna in the colon is constipation. Ruksha Guna in the nucleus pulposus of the intravertebral disc is degeneration. Ruksha Guna in the myelin sheath is demyelination. Ruksha Guna in the colon and water-filled cells are dehydration. See how many possibilities are there for Ruksha Guna. A single property of Vada, Ruksha Guna, can be applied in epithelial cell, in neuron, in nephron, in RBC, WBC. So identify the impact of each Guna in each cell, then that is called cell injury in Ayurveda. My humble concept is Ayurvedic histology. What is Ayurvedic histology? You study the impact of individual property or combined property in a particular cell. That is nothing other than Rogastu Dosha Vaishamyam. Ruksha Guna plus Ushna Guna together working in a epithelial cell. Ruksha Guna and Ushna Guna together working in an epithelial cell. The cell will die and shrink. Ultimately, Shosha. The treatment is Brahmana. You will think about a drug which is Vada Pitta Samana. Vada Samana means Ruksha Samana. Pitta Samana means Ushna Samana. So almost all the Vada Pitta Samana drugs will rehydrate, will do Brahmana, which can be given in Shosha. That is why, my dear Vidya, so identify the involvement of a cell using the Ayurvedic histology concept. The word itself is my concept, Ayurvedic histology. You know all the internal tissues. You know what is osteocyte, you know what is myocyte, you know what is spermatocyte, you know what is epithelial cell, you know what is RBC, WBC, neuron, nephron, everything you know. You apply how Ruksha, Ushna, Vishna, Snigdha, Sandra, etc. will work in each cell. That is what is called Ayurvedic histology. That knowledge itself is called Dosha Vikalpa Vijnanam. Okay, so then naturally you will feel that this is happening to my cell. When there is a liver cell getting accumulated with fatty globules, you identify Snigdha Guna of Kapha with Medas is increased in liver. When the RBC is undergoing hemolysis, Ushna, Vishna Guna of Pitta is destroying RBC, so there is excessive hemolysis, there can be hemolytic jaundice. So do Pitta, Ushna, Vishna, Hara Chikilsa, Kamalayantu Pittakram, Pandiroga, Virodhiya, Chikilsa Sutra is justified. So every time, my humble point is study the 2 spheres of medicine. Egam Shastra Madhya Nuna Vidyan Shastra Nisya, we every time tell. But unfortunately, even I don't know whether I should tell or not. I am placing before you, you just think about it and make a decision. You study minimum Ayurveda, you study minimum modern medicine, but one thing is sure, we never study any system completely. Creating Alpa Dosha Avashesha in both the sphere, that is creating Alpa. If you study only Vada, only Ruksha, only Vada Slovakarma Sneha, you practice very well. But what is happening? We will learn little neurology, little rheumatology, little Vada, then we will create our confusion. So study whatever you can, but that should be studied with the crystal clear transparency and perfection. Perfection in the sense a particular patient level perfection. Of course, the knowledge is, the glory for knowledge is never ending. So I am concluding, your minimum responsibility is to study the fundamental principles of Ayurveda, fundamental knowledge of anatomy, physiology, and pharmacology, and see the different yogas, and do the patient examination, interpret the laboratory examination. I have told some example from each system. I have touched cardiology, hepatology, neurology, rheumatology, pulmonary medicine, endocrinology. Some areas I touched with one example. Even in skin, dermatology, I will tell something also. You know, actually, skin diseases are the typical example of dosha vikalpa. Padena kushtam kabalam, pitta, rodumbaram kapat. We are telling dryness, scaling, cracks developing are Ruksha plus, triple plus. Ruksha Guna plus is dryness. Ruksha Guna plus is dryness with scaling, psoriasis. Ruksha Guna triple plus is cracks developed Vipadika. So same way you can see Ushna Guna, etc. in Pitta will be producing Daha, Raga, Paga, Shobha, inflammatory skin, blood pus accumulation, etc. And Kapha will be always Chirakarita, chronic pathology, Srava, Kleda. Kleda means more discharge. The Kleda can be judged by the presence of itching, Kandu. So internal Kleda will reflect as external Kandu. So do Kleda Shoshana by Arakudari, by Kadirarishtam, by Sharibadhyasabam, by Vamanakarma, Viridanakarma, external Eladi Zone, etc. Washing Chalana with Tripaladi Kashayam. So Kleda Shoshana locally and systematically will prevent the Kapha because most of the time Kleda is Kapha related. So dryness, scaling, roughness, more pain, etc. Vada dominant skin condition. All red color, pus formation, bleeding, swelling, tenderness, local temperature, Pittaja, and all oozing, itching, congested, swelling conditions with chronicity and relapse and remissions. Apajam. All slow progressive skin disorders are Apajam. All acute conditions are Pittajam. Almost irregular pathologies are Vadajam. So that is dermatological understanding. Then you can go for the treatment also accordingly. Never apply Sneha Chikilsa when there is internal Kleda. Do Klena Shoshana, then only go for Snigdha Chikitsa, as very well told in Visarpa Chikitsa. So Ayurvedic dermatology is embedded in Visarpa Chikitsa, Kushta Chikitsa, and even in Shitra Chikitsa, Shudra Roga Chikitsa. Everywhere the point is simple: reduce Kleda, then increase Toxara. Reduce Kleda, then increase Toxara. So that is what I have to tell. I think I have touched almost every system and with one examples. So I will tell some more thing before I conclude as an experiences. When I was facing a case where there was urethritis and joint pathology together, I got a case, urethritis and not like a Richter syndrome, but urethritis was there and the arthritis was there. I was having doubt to treat which first, urethritis or arthritis. Urethritis treatment, I have to think about little Pitta Samana Chikitsa because that urethritis was Vada. But I thought that the Chikitsa done for Pitta will be generally Sida, which may aggravate the Vada. But I thought that urethritis is creating more problems, so I started urethritis by Sida Virya drugs like Shadavari, Chinnadukadi, but that proven to be an Anubhashya. So then I understood that never follow blindly the modern clinical condition. If there is an Ama Anubandha, first respect Ama. So what I have done later, I have selected a Kashaya which is Pitta Rasa, but having an action on Amapadana also, because Pitta Rasa is always Pitta Shamanam, Agni Divanam. So Amrotara like medicine, which are little Pitta, Pitta Shamana, and again Amapadana, that we have given, then we can treat. So there Pitta Rasas are important. Agni Divana, Pitta Samana, 2-in-1 needed. You think about the Pitta Rasa like that, then you can go for the specific Yadi Prathanika drug. So respect Ama when you are getting conflict between two conditions of different dosha domination. One more case I will tell you. Again, that case was Henosholin purpura, HSP case. In Henosholin purpura, due to vasculitis, bleeding will be there during skin, like Recta Pitta. Then there will be joint pain. I thought that Recta Pitta can be treated, but became problematic. So there also, I first started treating the Ama-oriented joint condition. I am telling you, when you are getting a Kapha Pitta pathology, it is better to treat Kapha first because Kaphagara Chikitsa is Ushna. But Kaphagara Chikitsa by Pitta Rasa will not cause Pitta Prakopa, and Pitta is good for Kapha and Pitta. So Panchatiktakam was the choice. You know, Panchatiktakam, Nimba, Amrata, Padola, Busha, Nidiktiga. Panchatikta is good for Pitta, Panchatikta is good for Kapha, and it is good for Agni. So that is why Rasa is important. So never try to attack the disease by the most powerful Virya drug straight away when there is equal power for two opposite conditions. So Panchatiktakam was given, and that controlled the Sandhigata Shobha, and Pitta Rasa was good for the Recta and the Pitta. Then of course I turned into Vasha Guduchadi, Recta Pitta Samanam, but Vasha Guduchadi contained Guduji, a very good drug for joints. So this is the logic of selecting drugs when opposite interests are there. I am telling you 2-in-1, 3-in-1 concepts. When you have to do degeneration conditions, you have to treat the degenerative condition, there are 3 points. Brahmagana, Agni Divana, Srodho Sodhana, but all the 3 should be done together. Brahmagana, Srodho Sodhana, and Agni Divana. Why? Never do Brahmagana straight away. First do Agni Divana, then Srodho Sodhana, finally Belya. The best example is Shatpala Gridam. Shatpala Gridam will be doing all the 3. Prastuvanidam, Tulyavaya, Srodhasanta, Vishodhan. Because Shatpala Gridam contains Panchakola, Yavachara, Shatpalena, Padya. So my point is doing all the 3. Prastuvanidam, Tulyavaya, Srodhasanta, Vishodhan. Because Shatpala Gridam contains Panchakola, Yavachara, Shatpalena, Padya. So my point is you first do a Grida, which is Divana, Srodho Shuddhikara, also Belya. What is the function? Deepana will empower the Agni, the Srodho Shuddhi will take the Sara to the next deliverable site, and that is called Brahma. But if you are straight away giving Vidaryadigrada to the patient thinking that Brahmana will be done, Vidaryadigrada itself should be digested. That will not be digested because it is a Guru Kalpana that itself will add to the existing Ama, creating further complication. Brahmikyastu Mradu Lankayet is the concept. Never do Brahmana without doing the Lankana, that is mandatory. So identify whether there is a Srodho by modern laboratory investigation, physical examination, then do the treatment. Actually, I am concluding only 3 points. The status of Agni, the condition of the Srodhas, and the operative level of Vata. These are the major 3 conditions which will help in every way. I am repeating, status of Agni, condition of the Srodhas, and operating power of Vata. These 3 are inevitable in every disease. Status of Agni may be at Koshta level, Dhadu level. In thyroid, Dhadu level. In Ajirna Grahani, Koshta level. And status of Srodhas, what is Srodhas? Adipravarti, overproduction. Apravarti, ischemia, Sangha, Rodha, hypoxia. Siranam Grandhi, aneurysms, atriovenous malformation, and all Sira Grandhi, varicosity, all esophageal varices, everything. All anatomical malformations of the blood vessels are called Sira Grandhi. And Vimarga Gamanam, the transport of one cell component to another tissue. The calcium from the bone is taken by the blood to the kidney, leading to deposition of calcium in the kidney in nephrocalcinosis, especially multiple myeloma, is Vimarga Gamanam. You know, Karaguna of the Asti is contributed by calcium. But that calcium is taken from the bone and it is deposited in the kidney. What is happening? Asti Vaha Srodho Gata Karaguna calcium is taken away, so Asti Chayam. But this Karaguna oriented calcium is deposited in Medo Vahana Srodhaspolitam Brukka, nephrocalcinosis, kidney will fail, bone will get damaged. That is occurring in multiple myeloma, a common cancer. You know, the clinical feature of multiple myeloma we used to tell by the word CRAB, C-R-A-B. C for calcium depletion, R for renal failure, A for anemia, and B for bone resorption. crab, C-R-A-B. You see, you can see R Srodo Dushti in C-R-A-B. Imarga Gamana is not vomiting, it is not diarrhea. Imarga Gamana means from one Srodas, it is taken to another Srodas by Vata. Best example is bone calcium is taken to the kidney. So kidney will suffer. If kidney is suffering, no doubt there will be reduced production of erythropoietin leading to anemia. That is why crab, C-R-A, anemia. R, renal pathology. So that is why Ayurveda told when there is Pandu, when there is Shobha, you can always suspect the pathology is in kidney. That is why most of the time the medicines of Pandu and Shobha are mentioned together. Punarnava Manduram. See, Punarnava Manduram. Punarnava, Shobha Shamanam, Manduram, anemia, you know, both will work in kidney. So without telling any word, it is clearly mentioned that, without telling any word, it is clearly mentioned that Punarnava Manduram is indicated in kidney disease. Okay, so this is what I have to tell. I think the time is coming up. So my dear friends, my conclusion is study the fundamentals, try to read in between lines, understand physical examination with the unparalleled clinical skill, and develop the communication skill of interpreting laboratory investigation. And every time, never forget to use our common sense and believe that common sense has no boundary. It is to be developed all the time. Then naturally you will become a better clinician. Jnanabuddhi pradivena yona vishyadi yogivat avirasya antaratmanam nasarogam chikitsati. And also, dusham desham belam kalam analam pragritim vaya satvam satmyam tadaharam avastasya pradakvidha sushma samishesha dosha aushada nirubane yo vartade chikilsayam nasas kaladi jadujit. Dosha chikilsa and Devya chikilsa both are related. Pharmacology to pathology, pathology to pharmacology. You will be in the middle. Yoga to yoga, yoga to yoga, you will be in the center. And that center person is important, that is you. So try to empower you. So I am very much thankful to all of you for your patient listening. Learn Ayurveda, love Ayurveda, live Ayurveda. Thank you very much.
Thank you, sir. Thank you for enlightening us. It's always a blessing to hear your classes. I have been blessed many times to hear most of your presentations in many of the venues. And I think we will be taking some of the questions from the participants, sir. If anybody wants to ask the question, they can raise their hands so we can directly chat with sir. Please raise your hands and you can directly, or else you can also write in the chat box so that I can ask the question directly to sir. Okay. I think, sir, as this is the first class, they are only warming up.
You can communicate me later in my WhatsApp number. I will be happy to clear my doubts.
Yes, sir. Thank you, sir. Thank you, sir. So I think that as nobody is posting any questions, I will end today's session here. Thank you, sir. Thank you once again. And
thank you.
Thank you. Is by an introduction to Ayurvedic clinical